Hi, my name is Vicky O'Dwyer. I'm a consultant obstetrician and gynaecologist at the Rotunda Hospital. The most effective is vasectomy, and it's probably not the one that people choose most, but I suppose for women the most effective is LARC, so Long Active Reversible Contraception. The LARC is a progesterone-only contraceptive. It's put into your arm, so just under the skin. There's a little device to put it in, and it's slow-release hormone. The IUD, there are 4 different types. So there's the copper coil, there's the jadis coil, that's your 3-year coil that's designed for women who haven't been pregnant before because it's small and it lasts 3 years. There's the coil, again it's a little bit smaller than the marina. Now it's about this size, it's a little white T. If you're looking for irreversible contraception, then tubal ligation would be next in line. But again, actually it's not as effective as the marina coil is. So the LARC is a progesterone-only contraceptive. It's put into your arm, so just under the skin. There's a little device to put it in, and it's slow-release hormone that works by, well, there's a couple of different ways that it works. So it'll, for some women, prevent ovulation, it changes the cervical mucus, and it keeps the lining of the womb thin so that nothing implants into it and you don't get pregnant. So the IUD, so as I said, there are 4 different types. So there's the copper coil, there's the jadis coil, that's your 3-year coil that's designed for women who haven't been pregnant before because it's small and it lasts 3 years. There's the coil, which is your 5-year coil. Again, it's a little bit smaller than the marina. So first step I'd say is look at your GP website to see, do they do coil insertions? If not, one of the family planning clinics. The hospitals also do them. So the Rotunda has a GP-led coil clinic. First step is to have a consultation to discuss which coil is the right coil for you. You then will come back for another consultation to have the coil inserted, and then a follow-up consultation 6 weeks later for what we call a string check, where we check that the coil is still in the correct position. So it's covered under the free contraception scheme, which would be 17. What I would say is, as a gynaecologist, I put in coils for younger girls. Now it's usually for heavy periods, but as young as 13, a coil can be put in. So really anyone from the age of 13 can have them put in, but usually under general anaesthetic at that young age. I don't think so. I certainly prescribe them, as I've said, now mainly for heavy periods or painful periods and endometriosis. But yes, you can have one if you're younger. It's not painless. So what I would usually recommend is Ponston and a tablet called misoprostol beforehand that softens your cervix. So it makes it easier to put in and less uncomfortable. Most people find the first part where we look at the cervix like a smear test, a little bit of pressure with that. We put some antiseptic on the cervix and then we measure the length of the womb. So at that point, you're going to get some cramping. When they put the coil in, it comes on a little device that goes through the cervix again. And once that goes in, click a button and it deploys the coil, and that's a little bit uncomfortable. Some women find it too uncomfortable, and if that's the case, it can be done under local anaesthetic or for a very small percentage done under general anaesthetic. So you should discuss the different options. If you decide to go and get a coil, and if on the day you find the process too uncomfortable, you can absolutely stop. Just because you've decided to have the coil doesn't mean that it has to be inserted. If it's too uncomfortable, you can look at different options for insertion. It's very rare for them to fall out. So I guess the common reasons I would see they would fall out would be someone who has very heavy periods. It can fall out if you're passing big clots. Now it's about this size, it's a little white T, so it's unlikely that she would miss it falling out. It can sometimes fall out postnatally, so after you have a baby we recommend that you wait 6 to 12 weeks before having it put in to reduce the risk of it falling out. But it is very rare.